Hi, a big shout out to all the budding doctors, and this is your second year of MBBS and dental. And so you must be really, really proud of yourself because you've achieved your first milestone. It was tough, it was difficult, but yes, you've been through it, you've done it, and you've been through it with flying colors. So now, congratulations that you're now into the second milestone. So, second milestone is your second year MBBS, and definitely you must congratulate yourself. You must celebrate your win over the first year. The first year is over, done with, and now we are going to begin in the second year of pharmacology. So here, what I'm going to do here is give you certain tips about how to study pharmacology in your second year. I am Dr. Deepika Tikku, Professor of Pharmacology, and I've been teaching pharmacology for the past 10 years or so, and have gathered a little bit of experience regarding what are the problems that students face while studying pharmacology. So here I will give you some very, very crisp, very simple tips on how to go about it, so that your journey is very simple in this process. Now, see, your main subjects are going to be pharmacology, pathology, and microbiology in your second year. And what actually I want to tell you in this video is like what are the basic things that you need to have with you during this journey. How much time do you give to certain these pharmacology topics, so one by one you can cover them well ahead of your examination time so that you have time enough to revise also. And what are the different strategies that you can follow so achieve this in a better way, in a quicker way, and in a simpler way, right? So let's get started. Now what you need is a standard textbook. So you need a standard textbook, you need your notes with you, and the third thing, which is your timetable. These are very, very essential things that you should have with you, because this actually is going to make your job very simple, make your task of learning this mammoth, big subjects very easy. So, talking about the pharmacology standard textbooks, I would say that you have all these options like the Pathi, Sharma, Kadzan, Goodman and Gilman. But see, let me be very frank with you. At an undergraduate level, you are not expected to go through all the books. Please, okay? So let's be realistic. We cannot go through all the books in second year, and because now the second year tenure has been reduced even further to what it was before, it's practically not possible to go through all the books. And why would you want to go through all the books when even one standard textbook can give you a clear picture? Okay? So follow, my advice is that you follow either a standard textbook like the Pathi or a Sharma. Keep that as your main Bible. The rest two books, Kadzan and Goodman Gilman, are not supposed to be your standard books. They're just your reference books, basically. They are more standard books, for reference people who already are doing post-graduation in pharmacology. So for them, more details are required. So definitely they go through this. But as an undergraduate level, whether you're an MBBS student or a dental student, you should only stick to either Tripathi or Sharma. And please just have one book. Do not go into all the books and study from here also and there, because that leaves a lot of confusion on the table, and that really makes your life a hell. Then notes. See, I can't emphasize enough the importance of notes. They are very, very important in your life, and you have to have notes with you, because this is what is going to help you breeze through your exams. क्या होता है कि when you make notes, and how will you make notes is you have one video channel. You should always have a video channel. Previously हम ये advise नहीं करते थे students to watch videos, watch YouTube videos and all. Don't get distracted. But now there is good information. There are certain very good channels who offer you like the जो textbook का knowledge है, they simplify it for you and they present it to you in a very interesting manner. So it's always interesting. Sometimes textbooks becomes really boring on their own to understand, and you kind of lose interest in them. So when somebody is explaining you in a simpler way on the video, so why not? So follow good channels, and please don't follow initially those 1 minute, 2 minute videos, because they are not getting the concepts. They are just enough for revision, and that will come later. But when you're starting off, so focus more on the concept. So take notes from those channels. Then your class notes. Absolutely essential, because when you go to your classes, you add on to those notes. Don't make separate notes. Make one single register for pharmacology, and topic wise you make the notes. So if for example you are going to study rules of administration, start with the rules of administration from any video before you have started the class itself, so you have a prior knowledge of what you're going to do in the class, and that makes understanding in the class more important. So kya hota hai, so first time you've studied there on the video, and hardly watch videos which are like 30 to 40 minutes duration, usse zyada nahi hoenge, hone chahiye bhi nahi at this level, but they are enough to build your concept. So that is enough for you to take it. So 30 to 40 minutes I would advise. Make your notes side by side, and then when you go to class, add on to those notes from the class. The third reading, when you go back and do from your revise from your textbook, so your textbook is going to be very, very simple. Then you will find it very easy to understand your textbook. And textbooks are mainly meant for, if you have those what do you call that, routine classifications, okay, those kinds of things, they come from the textbook, so you write them accordingly. Okay? Don't go for don't go for drugs which are not used, and which are very obsolete. Don't bother remembering about them. Don't bother. Okay? Or always your notes are going to be with you. You have to don't write notes on pages, different, loose pages. No. Please make a dedicated register, because pages you will tend to lose and your efforts are gone down the drain. Okay? So use them also for the final reading during your exams, because this is your comprehensive, you have made your own book of pharmacology, okay? And that is written by you, and you're the proud author and owner of that notes, so stick to that. Then what else is important? Then we come to the importance of timetable. Now timetable, again, you set it on your table, okay? It is meant to be followed. So do not make very fancy, very elaborative timetables, okay, जो आप follow नहीं कर पाओगे. So make very concise, because once you get back from college, you don't have 10 hours to study. You have to sleep also on time, get your sleep, and you have to have your dinner, and you have to unwind, right? So 3 to 4 hours are more than enough after your college hours. If you've if you do your job properly, if you do it studying every day, so 3 to 4 hours is more than enough. So divide those 3 to 4 hours in slots and dedicate your time. For example, it's like 7 p.m. to 8 p.m. for pharmacology, 8 p.m. to 9 p.m. pathology, and write what chapter are you going to do. Because that way, when a deadline is always there, you would tend to finish the task easily and in a more comprehensive, in a better manner. Otherwise, if you don't put a deadline, you will spend all those 3 hours only doing one subject. The rest of the subjects you cannot do, and that leads to more of stress. Okay? And that we don't want that stress in our life, right? So keep one major subject and then keep on revising the other subjects. So timetables में वो sticky notes मिलते हैं. There's a bundle with colorful sticky notes. Just write on them. Don't go on writing. Sometimes people overdo, like इतने बड़े timetables बना लेंगे and सजाएंगे, ये करेंगे, but उसको follow कोई नहीं करेगा. So पहले आप initially every day का timetable बनाइए, and once you're successful, then start making for the week. उससे ज़्यादा आप ना बनाओ, because it is difficult to follow longer timetables because it becomes very difficult. And celebrate every day, celebrate each win. So whenever you're able to complete those 3 important tasks, so you know what, you feel happy, your brain feels happy, and you are pumped up, and you get up to work the other day. And if you do not do this, then what happens is, if you set too high goals for yourself and you're not able to achieve it for some reason or the other, then you tend to feel depressed, and that goes on to the next day and affects your next day. So don't let that happen. Small victories, small aims rakhiye, small objectives rakhiye, and try and achieve that objective, right? Okay. Then how much time do you think should be given for each pharmacology subject? That is the main important thing. So I have tried to tell you that the best possible time which can be devoted to each section of pharmacology, so that you're able to finish things on time and well ahead of time, and you have 1 month still left to revise, and you are really what will happen to you, you'll be so proud of yourself also, and that gives you confidence. So for general pharmacology, your 3 weeks are more than enough. It's a basic chapter, so when you start a pharmacology, you will take some more time to get used to it. So your routes of administration, pharmacokinetics, pharmacodynamics, adverse reactions, factors modifying drug actions, these will be covered in general pharmacology. So more stress to be laid on routes of administration, kinetics, receptors in the dynamics, and little bit about ADRs. जो है clinical trials and all, they're not asked that much, but yes, you need to go through it once, because कई बारी examination में in theory exams they may ask you about adverse drug reporting. That's the major thing which is important here. So you need to make so overall 3 weeks are more than enough. Don't give exaggerate नहीं करो ज़्यादा 3.5 weeks, but ज़्यादा नहीं. Don't give much. इससे ज़्यादा don't extend, because you're studying regularly, it won't take that much time. Then autonomic nervous system, 1 month, because it involves your adrenergic system, your cholinergic system. So whether you're going to do both the mimetic and the the lytic part for both the systems, so it will take about 1 week. अगर हम एक को भी लेके चलें, 4 weeks are more than enough for autonomic nervous system. Autocoids respiratory system, 2 weeks. इसमें से भी you give 4 days, actually not more than 4 days to respiratory system. The rest you can give to autocoids. You can even finish it quicker. So, but just because इसमें autocoids में जो important इसमें NSAIDs and all, they're also given under this section, and rheumatoid arthritis and gout, they are very important sections. So for that matter, I've given 2 weeks. So 2 weeks would be sufficient to finish autocoids and respiratory system together. Endocrinology again is a big section, but it is actually very simple. It's not, you see the physiology part you've already done in the first year, but yes, when we talk about pharmacology, so especially when I teach pharmacology, I tend to revise or review physiology again, because only then it is easier to understand the drugs that are acting on these. So that is one of the important things. Endocrinology में diabetes है, thyroid है, osteoporosis is very important, and female contraceptives and female sex hormones. So all these are important, and they're easy, they're interesting to understand. So 2 weeks would be sufficient for endocrinology. Central nervous system, it's a very, very important topic, and it has a number of subjects actually, topics in that. So 4 weeks again you would require for central nervous system. Cardiovascular system, another important topic, 4 weeks for that. Then kidney, drugs affecting kidney, 1 week, because उसमें 2 ही chapters है, diuretics and antidiuretics. So 1 week is more than enough for this. Don't give much time. Blood में hematinics and drug affecting coagulation disorders, and even in this you can cover the hypolipidemics. So 1 week again is enough for blood. GIT 5 days. GIT में बहुत ज़्यादा complicated नहीं है चीज़ें. 5 days is sufficient for GIT. Coming to your skeletal muscle relaxants and your local anesthetics, you can do 5 days for that. More than enough. 5 days is enough for this. General chemotherapy, because we have two chemotherapy हमने 2 में divide किए, general and systemic में. So general chemotherapy would take you 2 weeks. And similarly, your systemic chemotherapy, because there are so many viruses and bacteria, other infections specifically involved, like tuberculosis hai, leprosy hai, fungal infections hai, viral, HIV, all those infections are there, amoebiasis, helminthiasis, तो वो सारे 2 weeks में आराम से cover हो सकते. Coming to the anti-cancer drugs, don't see. Yes, you have to know about certain drugs which are older drugs, much more important as compared to the newer ones. Don't waste your time remembering so many names of the newer drugs. Possible नहीं है, practically possible नहीं है. तो if you see my lectures and all, I will tell you the important drugs which are supposed to be remembered or which are important for examination. Please don't go into vast depths में जाने की इसमें बहुत ज़रूरत नहीं है. So 5 days enough for anti-cancer drugs also. Last we have your miscellaneous. Miscellaneous में we have vitamins, chelating agents, etc. and all those things. तो उसमें भी 5 days, ठीक है? जो 5 days are more than enough. So overall, if you see, the total time which will take for completion would be around 6.5 to 7 months. You still have 1 to 1.5 months, almost 1 month left to revise the topic. And if you've done your everyday work according to the timetable, if you finished your tasks dedicatedly every day, you will feel that there is no problem in revising these things, because you have your notes, your own book with you that you have made. So I'm sure that that will be really really handy, and you should keep it with you till your post-graduation entrance also, because side by side आप question solve भी करोगे, because when when we ask our students to solve important questions as they cover their subjects, so that becomes very easy, because one is your just the knowledge part, one is how to apply that knowledge. So exam में जब पूछेंगे, so whatever आपको आपने पढ़ा है, how will you apply? So we give a lot of practice questions that ways, and that's how we go about that. So you have enough time, and if you do it for all your subjects, you will be a top scorer, that is for sure. There is no stopping you, right? So now, what are the strategies that you should follow? Simple strategies. I don't give very long fundas because that is not practical. I will give very simple strategies to follow. सबसे पहले हमने बात की, follow your timetable strictly. Please be true to yourself, be honest to your profession, be honest to your studies, be honest to everybody who's around you, your parents, your friends, people who have put their trust in you. So follow your timetable strictly, and you will definitely feel less stressed, more motivated, more happy in life, and you have time for everything else, extracurricular. ऐसा नहीं है कि medical students हो गए हैं so they cannot do anything, they only have to study. No, please, it's a myth. If you make the best use of your time when you're studying and study focused, you can have time free also. Sundays को off रखो, enjoy yourself, de-stress, unwind, and again be prepared for Monday onwards. So there's all the time for you to even hang out with your friends, hang out with your family. There's no need to seclude yourself in a separate room and just study. That's only when you have not structured your timetables. So go from notes to books, revise, and then repeat the cycle. Discuss and learn. If you are lucky enough to have friends with whom you can discuss your subjects and topics, you better discuss. And because what happens is, until unless you have friends who are wasting your time, you would know who are the negative people or who are the positive people in your world. So keep negative people at bay, keep positive people with you, and if you know they're not your time wasters, then they are like-minded, आपके level के हैं, wavelength के हैं. So try and discuss topics, because when we discuss topics, we tend to remember more. Join a community. We have various forums of pharmacology now, community of pharmacology online, Facebook groups हैं. I have a Facebook group of pharmacology students. I've just made it because that is just to post certain events, not events as such, certain updates, or वैसे बीच में motivational things, and you pose a question in between so that you can recall, this is something that it alerts your mind, it triggers your mind to answer, and you can recall, yeah, ये तुमने कहीं पढ़ा था. So if this is a question, how will you answer? So this is the answer. So that is meant to engage and to discuss, and in case there is a problem, meant to solve the problems also. And it is very important to acknowledge your small wins. As I said, every day acknowledge what you've accomplished, reward yourself, give a pat on your back, and march ahead. Do not only try to think on the that thing कि मेरा इतना लंबा भी प्रोसेस है, मैं वो कैसे करूँगा, मैं पोस्ट ग्रेजुएशन कैसे पास करूँगा, मैं फाइनल में कैसे पास करूँगा. Be in the present. If you are whatever where you are, please do that right. Everything else will follow. ठीक है? If you have focus there, everything else will. Do not fear. Fear is crippling, as they say. जब fear डर आ जाता है ना, it cripples you. It cripples your mind, and you cannot learn. So do not fear. When there are ways to accomplish things easily, I'm not saying it is, it's a cakewalk. You have to make an effort, but then it becomes easy. So do not think कि I'm into this profession and think about people around you. उसका ये हाल हो गया, उसका ये हाल हो गया. No, just focus. Don't be around negative people. Spread positivity. Be positive, and I'm sure there's nothing which is a problem. So wake up. Make a plan and start working on it. That's my message to all of you there. So if you enjoyed this video, please like and subscribe, and I'm going to put up more of such content along with some pharmacology lectures alongside. So see you later in the next video. Thank you so much.